Hey, everybody, welcome back for, I don't know, number whatever in our series of interesting interviews with interesting people in the professional beauty, barbering industry. We've had quite a influx of really, really interesting groups, but I think this one might take the cake for who we've talked to recently. I've never done an interview, as you all know, with this many people, so we're going to see how this works. It's usually at the most one or two people. But this group is the National African American Male Wellness Agency. I had to cheat and look at it for a minute because there's so many words in there. But we're really delighted to have this conversation with them today. And I'm going to let them introduce themselves. We'll start with Luke, and Luke can tell you a little bit not only about the program, but also about himself.
How you doing? My name is Narahari Luke. I'm actually the program manager of what we are going to be talking about today, which is our Real Men Real Talk initiative and our Barbershop Talk initiative. Barbershop Talk event. So we are super excited to talk about these two things today and really talk about the National African American Male Wellness Agency in whole. But my position, we actually have a year-round program that we're currently working in the African American community wrapped around mental health of African American men. And what we aim to do really is to eliminate the stigma and then raise the awareness in the African American community around mental health. And what we're able to do and the ways that we're doing that is we actually have an initiative called the Real Men Real Talk initiative. And that initiative is a year-round program where we meet with men 2 times a month to talk to them about their mental health needs and really their mental health interests. And what we really aim to do in those conversations and discussions is to really offer them a safe space to have discussions with the community about their wellness needs. So and what we do in response to the discussions is we actually are able to refer those individuals out to different services. And really one of the significant parts about what we do is actually our referral process. We look to refer those individuals to individuals that look like them. So if we're referring out an African American man, we really look to connect them with somebody that will be able to help them and really relate to them to the core. So that's one thing that we do. And then in regards to our actual year, our wraparound event, our Barbershop Talk event. So we do a big Barbershop Talk event, which is a Barbershop Talk conference. And in that conference, we actually have discussions wrapped around mental health. And then we actually go into breakouts. I'm actually let Chavez speak on the actual event a little bit more, but definitely just super excited to be on the call today and super excited to get this going.
All right, perfect. Let's move on to Marlon. Marlon, tell us about yourself and what your role is in the organization.
All right, thanks for having us. Yes, my name is Marlon Platt. I'm the executive director for the African American Male Wellness Agency. I've been with the agency for a little more than 2 years now. Still great to be here, especially now that we've newly formed this organization. My previous work includes work related to community programming and community engagement and community service. So it's great to be somewhere we can continue to do that and help save African American men and their families. The agency is really growing. It's something that we're all excited to be a part of. We started out originally as a team of 3, and now with our agency, we have about a team of 10. And so it really just shows that we are really doing a lot of work. We're staying really busy and active as we continue to expand and grow, not just here in Columbus, Ohio, but in our other 16 cities that we have a footprint in across the United States. And so as we find ourselves being at the forefront of health and wellness and messaging for African American men and their families, we just want to continue to do the great work. We want to continue to be boots on the ground. We want to continue to go out and engage and reach those who are hard to reach and underserved. And most importantly, we want to continue to save Black men's lives by providing free community programming, education, and health screening. So, we're excited. Thank you guys very much for having us on today.
All right. Thank you. Perry, tell me a little bit about you.
Definitely. Hello. My name is Perry Jenkins. National Walk Director for the African American Male Wellness Agency. So as Marlon mentioned, as the agency as a whole, we do year-round programming. One of our biggest and our probably most popular event is the African American Male Wellness Walk. The walk started back in 2004, only had about 700 people participate. And if we fast forward to 2019, what we've been calling BC before COVID, we had 30,000 individuals in attendance at the walk here in Columbus, Ohio. My role with the company, however, is really to help with the expansion of the walk. We're really breaking ground in new markets, and then also in the other markets that we are already in, we're looking to grow to the size that we are in Columbus or even bigger. So Columbus is our corporate, it's our largest walk, but we have walks in Charlotte, North Carolina, Atlanta, Georgia, Washington, D.C., just to name a few. We're up to about 17 cities now. So this year we'll be walking in 17 cities. So it's new for us. As for that many cities, what happened was in 2020, we couldn't walk and we couldn't gather and do the walk in person. So we did a walking your own hood campaign where we had people walking in their own areas. And we did a digital marketing campaign where this reached over 32 different states, 161 different cities. So then people are coming to us saying, we need to have this walk in our area now. You know, we want to have this in our city. So this year alone, we're going to have 5 of our walks are going to be in a new city. So we're going to have first year walks in 5 new cities this year. So that's my role with the company, really expanding and growing those walks outside of our corporate here in Columbus, Ohio. Thanks for having us.
All right, I got lots of questions for you. Let's get to Chavez and let him introduce himself, and then I'll get all kinds of questions brewing.
How you doing? My name is Chavez Moment. I'm a master barber of over 25 years, and I'm new to the agency, but I'm not new to the agency. So my role in the agency is an engagement specialist. Basically, I'm here to engage the barber and beauty community with the agency. I'm that link between the agency and our industry. So I'm here to make sure that we have connections like this. The agency with Barbicide, seeing how you guys are #1 in the industry when it comes to sanitation and all of that good stuff. So it was just a natural pairing when I came on. I've only been on for like 3 months now. So my initial one was, let's get hold of Barbicide and let's see how we can work together to be a positive role in our industry. Because what we have is we have barbershop talks. And what we do with our barbershop talks is we actually bring barbers and healthcare professionals together in a barbershop forum where we can share information about healthcare and mental wellness and mental illness, along with pairing them with the agencies that they can go to for the help when they have a crisis or when they have a problem. So that's what we do, is we bring an organic setting, just like in the barbershop. So we ask questions that are relevant to men's mental health. And once they open up like they do in the chair, we bring on the healthcare professional to tell them how they can handle it in a professional way and what they can do, you know, when they have these crises. And we also provide them with resources at the end so they can carry on. So this partnership is great. So it helps our barber community along with the community that we serve. So I'm happy to be on here and look forward to a great partnership.
Excellent. So it's great to hear from everybody. I don't know who on this call knows about my background, but my background is as a nurse. So I went to nursing school, licensed as a nurse, and on a lot of the calls that I have been on since COVID started, a lot of the interviews that I've had with various different agencies, particularly when we talk about men and how men of color have had such a hard time with COVID. It has been devastating to men of color across the board. When people have asked me about that, I think, you know, if you've listened to me do any interviews, you've heard me say one of the problems in every community for men of color is that they only go to the doctor when they're sick. Like they go when they feel sick, right? They don't just go just to get a checkup. And one of the problems is that what we call underlying conditions, things like hypertension, you know, high blood pressure or diabetes, actually you don't feel too bad, right? So you go around being sick for a long, long time, and then you get COVID and it impacts you in just so much more severely than it does somebody who maybe has gone to the doctor, been diagnosed, they're managing that. So all these conversations that you guys are having, whether it's around mental health or all of their health needs, is something that I've been saying since the beginning of COVID. And the very first interview I did, if you've seen all these interviews, happened to be with somebody I know very well, my husband, who is a mental health professional. He is a therapist. I found it interesting when you guys were talking about referring to men that look like them. So another man who's African American, and how hard that really must be to find those therapists. Because I know my husband, people have a hard time just even finding a male therapist, more or less when you start getting into a specific ethnicity. So I commend you for trying to do that. I do think that it helps when people can talk to somebody that understands their exact situation a little bit better. So I have a couple questions. You're based in Ohio. You have 5 new states. Perry, what are your 5 new states this year?
So we have first year walk cities. So yeah, because two of the cities are in the same state. So Pittsburgh, Pennsylvania, and Philadelphia, Pennsylvania will have their first year walks this year. Okay. Jackson, Mississippi is going to have its first walk this year as well. I'm trying to make sure I do this right off the top of the head. Los Angeles, California is going to have its first year walk this year, and Memphis, Tennessee will have its first walk this year. So those are the 5 cities that we'll be walking in for the first time this year.
So if a city wanted to take on having a walk, you said a lot of people participated virtually last year. If someone was listening to this and they were like, what does a walk entail? How would we make this happen in our city? And who does it include? Is the walk all African American men, or is it everybody comes and it's like a learning environment? Like, tell me a little bit more about the walk.
Yeah, that's a great question. I'm so glad you asked that. Yeah. So the walk is for anyone who wants to come to the walk, right? Yeah. And then how we really implement or break ground in new cities is really we try to build relationships with the community. So what we've done, we have the blueprints we've done in so many different cities. So what works for us, I'm sure there's other ways to do it, but what works for us is really to build a community committee, right? So what we'll do typically before COVID, we will actually go to these cities and have these meetings in person and provide lunch and food. You bring food, people are going to come out. But it's been different now with COVID, so we do these things virtually now via Zoom. And what we'll do is we'll let somebody from the city want the walk to come there, right? We don't really want to go. We want to be everywhere, but we know we can't do it all on our own. So we have to have the support of individuals that are there locally. So what'll happen is they'll come to us and say, I was at the walk in Columbus, or I saw this online. I want to have this in my city. I think we need it. Let's do it here, right? So let's say we're going to do that. So what we'll do is we'll use them. We'll work with them, to engage other people in the community, and we'll have a community committee meeting, right? And this meeting is going to consist of anyone in that city that is interested in saving the lives of Black men. So it's open to anyone, any race, any gender, any background, right? And we'll get them all on a call. We'll show them the video of the walk in one of our other cities, probably Columbus, because it's our biggest one. But we'll show them a Charlotte walk or anywhere else like that. So we'll show them a walk and say, we want to bring this to your city. Black men, and this is a national stat, Black men are dying about 12 years earlier than their counterparts. And, like you said earlier, people would think, there's violence and there's things happening in the world that those are number one killers, but the number one killers are those preventative diseases, blood pressure, glucose, cholesterol, things like that. So when we really make it relatable to them, let them know this is happening in your city, this is what's happening, and we have an answer that we feel is worked in our previous cities that we worked in to fix this, or at least minimize this. So we show them the walk. We let them know what our goals are with the walk. So we don't just do the walk, right? We do year-round programming as well. I think Marlon's going to touch on some of this, so I won't go too far into that. But we do year-round programming in 6 different focus areas, so I'll leave it at that and let him go into those areas. But we let them know it's a holistic approach to health and wellness, right? So the walk is really a good way to break ground because it's a fun community event, but we really want to let them know we're trying to save lives all year round. So we're going to do different programming as well to help these individuals too. So that's kind of how it works. And then from there is 6 degrees of separation. So they'll bring a friend, they'll tell a friend, this friend may work for the city, this friend may work for Parks and Rec, this friend may work for a barbershop or wherever, or a nonprofit or another community-based organization. We bring them all together and we collaborate. We don't want to reinvent the wheel. So if something's already happening in that city along these lines, then we want to see where we can fit in to help them out. And with the walk, the walk run part of it is the fun part, but our main reason for that is the health screenings, and we let them know that up front. So if there's already some community event going on and we can bring that screening component to it, then we'll go that route. So there's a lot of different pieces that go into it, but that's kind of the gist of how we come into another city. I hope that answers your question.
No, that's perfect. I mean, the whole time you're talking, I'm thinking maybe we could bring it to Milwaukee. Maybe Barberside could sponsor one because, I mean, I did an interview with a barber in Milwaukee. I don't know if any of you've seen this, but he actually has a clinic in his barbershop. A nurse practitioner comes in 3 days a
Oh,
week.
wow.
And so when somebody starts talking about something, he says, well, why, she's become sort of comfortable in that environment. Everyone's become comfortable with her, and they've been able. I can't remember the statistics, but like one guy got went and talked to her, ended up catching colon cancer in time and surviving because of that exact thing. You think about that's a great idea. The health system there put a office right in his barbershop, like it's a private area. It used to be his office, but he's like, it's so great for my community. So,
and I know I talk a lot, so not to get too far off track there, but Milwaukee would be an amazing place for us to be.
All right, we'll
the
talk.
African American community there, and then also and the other thing about the walk in other cities, when people come to us, we also let them know everything we do is free. So we do rely heavily on sponsorship and funding opportunities. When you said Milwaukee, I thought about one of our sponsors here, Molina Healthcare of Ohio. They sponsor us pretty good here. I know they're in Wisconsin, so yeah, we can talk about that later. But that's how it works. It's just conversations like that, and then we'll start to turn, and that's exactly how it works, just like that.
I'll interview you at the start line of the race. How about that? Okay, so Marlon, you want to share with us about the year-round programming a little bit?
Yeah, and so with us as an agency, we initially started with just the African American Male Wellness Walk. But as we continued to grow, we began to identify other areas of health and wellness where there were needs in the African American community. And so part of our formation of the agency was to say, hey, what areas are we going to focus on? What areas are we going to put our programming in to ensure that we're addressing the needs of the African American community? And we identified 6 areas. So we have fatherhood, we have financial wellness, we have health and wellness, we have mental health, we have research, and we have mentorship. And so when we put all these pieces together, we're hoping that we can build a holistically well community. And all of our programming, and a lot of times we work with community partners who hire us to do these programs, flows underneath these 6 areas of focus. So what we've realized is we continue to engage individuals and provide more resources and education and what we call pre-COVID touch point opportunities throughout the year. The more we start to see a better turnaround and improvement in the communities that are most hardest hit, not just by COVID, but just by health disparities in general.
Sorry, I don't know who would want to answer this question. I saw it. It came up. It warned me. I don't know who would want to answer this question. I love that you're being so holistic about what you're doing, that you're not just talking about this one segment or, one piece of what makes really a man, like all the parts that make you whole. Because, women, we're really used to that, right? I mean, one of the things that creates a huge disparity, I think, between men and women is that women, as we age, we go to the doctor regularly because we have other things that we're having done, right? And so women keep that connection with their physical health. Women talk to other women much more than men do. So we keep our mental health a little more intact. I'm not afraid to call my friend and say, oh my God, I'm falling apart, right? Where men just don't do that with each other sort of across the board. And so sort of fostering what we've seen work for women in the male population, I think is so amazing that you guys are seeing that opportunity. One of the things that when I was reading the promos, or not the promo, but the bios, is in the professional beauty industry. One of the things that we have found can be really useful, and I'm wondering if this is somewhere where there could be a connection, is that, when I worked in healthcare, women drive healthcare for their families, right? If I'm married to you, like my husband, got to go to the doctor. And then when he gets the labs back, I'm like, got to go on a diet. And I'm driving that decision for him to be on a diet or where we're going to go for our healthcare. And is there any branch of what you're doing or any goal that you eventually would start educating women about men's problems so women can better address them with men? I mean, that language piece.
So we've actually started that. And we do know that. And so we always encourage women to bring the men in their lives, whether it's their husband, their son, their uncles, their dads, all those people we know, particularly as men. that women run the household. It's looked at as a different way in society, and it's good to hear you say that, Lisa. But at least in the Black household, we know who runs our households. It's really the women and not us. And so what we began to do is, one, we began to be more inclusive as we look at community partners, and our communities our committees are very diverse as it pertains to men and women. So Luke has a mental health committee. He has a lot of women on his committee, and they're able to receive and disseminate this information to the men in their lives, as well as to the men that they're serving. And so Perry also, as he works nationally, has a lot of women who are involved, and they're able to receive a lot of different information that they would not have necessarily gotten had they just stayed in their area of focus. And so on the flip side, we've also started doing work towards women's wellness. And so this year, we're going to have our first ever Black Men's Health Week. But don't let the name fool you. We do have a day on Wednesday for women's wellness, and it's called Uplift Her, where we're going to provide mammograms and free health screenings and educational information to women. We're working with The Ohio State University to be able to do that. But we also want to share information about the entire household and how to keep your entire household healthy. So that is a very good point. A fun fact is that there are more women who attend the African American Male Wellness Walk than men.
Yeah.
Well, it could be because there's lots of single men there too. That could be the other thing.
Yeah,
But this question, I think, Luke, did you want to say? Because I have a question for you. Go ahead.
No, yeah. If I could touch on that a little bit too. Another thing in regards to really the women's approach. One thing that we're able to do with the Real Men Real Talk, and like you said, don't get fooled by the name again, is we're actually working with barbers and stylists, and really the whole barber and beauty industry. And with us working with the whole barber and beauty industry, we know there's a conglomerate of women that are involved in that industry. And we really are really using the barber and beauty industry as ambassadors for the African American Male Wellness Agency, and allowing them to get their customers engaged into the resources and then also the information that we have. So that's really the goal, is to allow that holistic approach really to take place.
So that you actually answered my question, because I think probably Chavez can relate to this, that one of the things that I have found when I'm out doing trainings, I mean, sometimes there'll be 1,000 people in a room I'm talking to. If I can give a stylist, if I can say to her, gosh, if a man sits down in your chair and says he's getting up to go to the bathroom 5 times a night, that's a problem. He needs to go to the doctor. Like maybe he's got a problem with his prostate. That is information that she's not going to say it directly to another man, maybe, unless it's someone who lives in her home. But she might say it to somebody's wife who sits down and says, my husband's driving me crazy. He gets up to go to the bathroom so much during the night, that type of thing. So I think that, however we get to people has value. Chavez, I want to ask you, I mean, obviously you work in a barbershop, you're in one right now. And do you find that these conversations that you're starting to have are getting easier over time for you?
Yes. And one thing about it, because you were talking about women and you guys lead us, that's very true. But the one place that men do talk, and they talk freely and open, is the barbershop. So men say things, here in the barbershop that they won't tell their wives, their spouse, their mother, their father, or anybody, clergy, whoever it may be. So here in the barbershop, we found this is the place that we can pass along that information about healthcare and mental wellness and everything, because this is where men are most honest and most open and most subjective. Right here, barbershop, I can have men do things that they really wouldn't do. We can touch men in a way that no other man would let a man touch them. So we also get in, spiritually, emotionally, and we get them to open up about things they never would open up in regular society. So this is a great time for us to promote health and wellness, and also promote the women in their lives, that when they open up, they need to have somebody who was able to receive what they're doing. Because a lot of times as we've grown up, we've been taught to internalize our stresses and our traumas. But now when we get in a relationship, we don't know how to open up. And that's what we want to do. We want to start those conversations to get men open and honest and comfortable and talking about the things that we need to talk about. Because, we get up 5 times to go to the bathroom. We think it's just because we drink too much water. But our wife knows that we need to go to the doctor. So, yes, we need to combine those two, and that's what we're doing here at the agency, combining all that. It's a family unit, and that's how we can, better help our men. So barbershop is a great place.
Yeah, and I do think, quite honestly, I think that is something that goes down sort of ethnic lines, if you will, because I think Black men and men of color are more connected to their barbershop. That's their community, and that's where their community is. If I walk into 90 barbershops, I'm going to see much more what looks like a friendship to me, like a community in an African American barbershop, than I'm going to see in a lot of other barbershops where men are just look at it as a service. I'm going to go get my hair cut and I'm going to leave. They're reading the paper or something, just sort of ignoring what's going on around them. And what I think is really great about what you're doing, this is a really hard time in America to talk about anything that is defined by race, right? One way or the other. But the reality is this conversation about race is allowing us to have this conversation, right? We acknowledge that maybe, things are a little bit different. Things are a little bit different in the barbershop that you work in. But what is so great about it? What are the things that we can elevate in that barbershop so that we can get people healthy, so that we can get people to go seek, physical health and mental health. So my curiosity around the mental health question, and any of you can answer this, is what are you seeing? What's like the most common thing you're having people tell you that they might not have otherwise told you? I don't know how to phrase this question, but I'm guessing there's a common thread that's running through the conversations you're having. And when you have that first conversation, I know it's awkward, but are you able to spot it now? Like, are you able to see it when that person's in front of you that they need something? Like, am I asking a question you know how to answer?
Yes. I would definitely say that, you definitely see when an individual is going through something, rather they're taking it hard, rather they're taking it light. And then, even after, when we think about the COVID-19 time and really coming off of that, we've seen a whole influx of brothers that really have just needed to get out. I mean, when you think about being locked in your homes and kind of just, barricaded in a situation like that, some people have never experienced anything like that. So that can really be traumatic in individuals' lives. So we have seen a definite trend in regards to individuals and their mental health. But really, I mean, that's what the whole program is about. It's really connecting the barbers, and that's really the strength in the barbers right now is really being able to have that connection with the people in the chair, because they'll be able to actually see what type of issues that the individual is experiencing. And if they have the right resources, and that's really what we look to do, is to equip them with the right resources that they're able to really help that individual in the chair. So I know Chavez, he had something he wanted to say, and then Perry did as well. Go ahead, Chavez.
Yes. Here in the shop, we have a relationship with young men since they're children. Now they're grown men. So yes, they open up and tell us stuff. And a lot of things right now is with the COVID and their mental wellness and how to keep things together. Because, you have your normal routine, and it kind of keeps your mental right. But now COVID shut down, you can't go any places, you can't see your family or friends. And, the barbershop is different. It's limited. It's not the gathering place that it used to be, but it's still where men just talk about what's going on with the way the world is right now. Because, African-American men, we've been told all our lives to suck it up and hold it in. So we really never had a place to really talk about what goes on in our lives. And the barbershop is a place of freedom where we can talk about what goes on whenever. So now it's really more about how to keep mentally strong during this COVID time. So that's where, we've had to have those conversations, and through the trainings and the partnerships that we've had with the African American Male Wellness Agency, we've able to see some of those things that men really don't tell us verbally, but their body language and the things they talk about, it let us know that they need some type of counseling, and that we can refer them to some of the partners that we have to get them some help.
Yeah, I kind of took your question a little bit differently. What I kind of got from it is like more so like a success story from the work that we've done with the barbers and beauticians. And so we put some of them, we were able to put some of the barbers and beauticians through what we call our best training. And then also, even some of them went through the first aid mental health training. So there's this, I'm not sure if you're familiar with it, but there's a first aid mental health training that's been offered. And it's similar to like your CPR and first aid, where you just get those ground level warning signs to look for and things to kind of look at and know. And what we've found, because we have our barber beautician mixers that we do, where we bring them together to get more engaged with them, but also to speak with more barbers and beauticians. And what some of them have told us is that they've actually used what they've learned from those mental health first aid trainings and from that best training that they've done to really help some of their customers. So we've seen that it's actually been effective and helpful to the community firsthand from the efforts that we've done. So that's kind of how I looked at the question that you asked. So
well, I mean, they're both great answers, because that's exactly what I was looking for. And I don't know if you guys have seen, but I saw behind Chavez, he's got the Barbicide certification, but on our website, we have Barbicide certification, we have a COVID-19 certification. And then this year we were approached by the state of Tennessee, and they're wanting their licensees, their cosmetology licensees, when they renew, to take education on domestic violence, like recognizing the signs, being able to offer resources. What can I do if someone's sitting in my chair and I think this is happening to them? Or what if it's me? What if I'm the cosmetologist and it's happening to me? What are my resources? And so we decided that it was a really worthwhile, thing to undertake. So we created a certification for domestic violence. And so it seems like kind of the same thing, where you're like training people just to see, you're not making them accountable for fixing anything, but you're giving them a method for recognizing issues and giving them some resource to go to. I have to tell you, it was one of the most popular things we did all during COVID, was this domestic violence training. We did it for free. Everybody who took it for free. It felt like a really good public service. So it feels like it's kind of the same thing. One other thing I want to hit on, and I think Marlon maybe said it, or maybe it was Luke, really talking about the young men who come in, that you've seen them, or maybe it was Chavez said, since they're young, you've seen them, right? So are you guys doing a lot with preventative health for young men, like around diet and screenings and that kind of thing? Are you doing preventative health for the younger men?
I know Chavez mentioned it, but I can answer the question as far as just health in general, not necessarily mental health, but we have a program through the agency called Cooking with Dads, right? And what we're doing is really getting the kids to learn how to make a quick, affordable, healthy meal at a young age. And it's also a bonding experience with their father. And we use the term dads loosely. So it doesn't have to be their actual father. It can be an uncle, a coach, a mentor, or something like that. Right. But it's really engaging the young man with the older generation of men, bridging that gap, and then also really learning these things. I can speak for myself personally. When I was a kid, I could make a peanut butter and jelly sandwich. I could make ramen noodles. I didn't know how to make anything healthy. And those things, growing up like that, is how these underlying conditions happen, and how these diseases, happen to our community. So we're trying to change it from an early age. So with the Cooking with Dads program, these kids are bonding with their fathers. They learn how to cook healthy meals. They're cooking, they're cutting, they're measuring, things like that. So that's one of our programs that we do. We have an entire fatherhood program where we do all these things for the youth, and along with the fathers that come to bring them together. So that's one of the things we're doing with the young men as well. We also had a real mental health talk session for high schoolers and middle schoolers too. So you could talk to that, Mr. Luke. And Marlon,
go ahead, Marlon.
Yeah, I was going to say, to Perry's point, we find ourselves working initially with African-American men, so typically older men. That's when you start going to the doctors, when you get insurance. That's when you realize you have these health conditions. So to your point, Leslie, talking about preventative care, and Perry mentioned the Cooking with Dads has been a very exceptional program that everybody loves because it brings together, that nutrition component, that fatherhood component, that actual hands-on interaction when you're doing something that kids love when they get to do what they see their parents do. So that adds to it. And so what we've done with the formation of the agency is kind of bridge that gap with our mentorship program. And so now we're working with a lot of kids who are ages 12 to 22. And you're at a point in your life where you feel like you're kind of invincible. You know, you can eat whatever you want, you can do whatever you want, you don't have to exercise, you don't gain any weight. You know, I miss those days. But also, you know, the kids in our community right now are dealing with a lot of trauma. And so trauma deals, you know, relates to their mental health. It comes out in how they perform at home, how they perform at school, and also extracurricular activities. So what we've done with our mentorship program is task our mentor engagement specialists with finding healthy outlets and activities for the youth to do. And so whether they're learning about finance, whether they're going to, you know, a real man, real talk conversation like Perry alluded to, where we're having conversations about mental health on Saturday, or we're just getting them into fitness. So we, you know, we take the kids boxing twice a month. And so it's really become a situation where we're addressing the African-American male at multiple stages of their life to make that preventable play.
So this program, you guys have thought of everything. It's really impressive. I have to tell you, I'm very, very impressed. I didn't expect to be this impressed. I expected it was going to be a walk and the few things I kind of knew about, but I'm also surprised I've never actually even heard about it until just recently. So I'm happy to be part of promoting it. You know, we have quite a few people that follow us on social media, and we'll send this interview out to a large number of people with whatever materials you want people to see to understand you. But before we wrap it up, I'd kind of like to go through everybody and give me, like, you know, what's your last thought? What's the last thing that you wish you had, you know, you had a question? What do you want to tell me or tell our audience that maybe I didn't ask you about? You can start, Marlon, if you want. You're there already on my screen, so go ahead and start.
They start with Chavez. I think the things that we want to reiterate to our audience, like Perry said, all of our programming is free and open to everyone. So don't hear the term African American male wellness and think this is not for, you know, women. This is not for people who are not Black. We are very inclusive of everybody, but we are very intentional about the audience we are trying to serve because of the long-term health disparity gap.
Yep.
And at the same time, just for any organization that wants to support, our programming is free. And so, you know, if you want to support, if you are looking to get your name into the African-American community, if you're looking to do work that addresses the health disparity gap and racial injustice and equity, be a sponsor, whether it be an in-kind donation, whether it be writing a check, you know, contribute to people who are doing the work on your behalf and be representative for your organization.
That's great. You know, I'll be, Charlotte's probably listening to this thinking Leslie's going to be hitting us up tomorrow. So I think it's a great organization. Luke, you have any last little bit you want to say?
You know, I really wanted to thank we're sponsored by the governmental offices of faith-based and community initiatives. So I really want to thank them and really just thank you guys for just even allowing us to have a discussion to bring awareness to our agency, because it's really these conversations like this that allow, like I said, that grassroots approach where individuals learn more about the agency and we get more exposure and we're able to connect directly. So we're super excited to engage. When I think about mental health and really think about the African American community, we have been working in this field for probably around 7 years, and we're really looking to, and that's just mental health. We've been in health and wellness since 2004. But when we think about mental health, we really want to have a direct approach and really just start breaking some of the stigmas and start allowing individuals to gain the awareness that's needed. This is a discussion that we need to have. We under our mental wellness initiative, we also have discussions about the opioid pandemic. And we also have a whole campaign that we'll be launching in April in regards to African Americans knowing the statistics and information about the opioid pandemic. So really just bringing awareness. That is what we do. So we're just thankful. And like I said, just looking to continue to connect. And anybody can connect with us. I don't want anybody to feel like, you know, we haven't left. We are here in Columbus, Ohio. We are able to connect, and we are in 17 different cities. So we're able. Thank you.
Excellent. Chavez, do you have anything you want to say?
First of all, Leslie, I want to thank you for inviting us and including us in your program, and thank you for what Barberside is doing for the barber and beauty community. We really appreciate you and the things you did over COVID with the videos and the training and all the domestic violence things. That was awesome. And things that we needed for our industry at that time. So thank you again. And just want to let everybody know that men do talk. We do talk about our health and our wellness, but that's in the barbershop. So we want to make it where men are more comfortable or talking about what goes in our lives and more than just the barbershop, in our houses, in our homes, in our communities. We need to start talking more so we can be better men for our community and be better leaders. So we want to let you know that the African American Male Wellness Agency is here for you on whatever levels you need, you and your family. So we welcome you to come out. And if you need us to come to your city to talk about mental wellness, Real Men and Real Talk is ready with the backing of the African American Male Wellness Agency. So we're looking forward to coming to Milwaukee to speak with Barbicide and the community in there. So I want to thank you for this partnership. We talked on some different levels before, but when I came to the agency, that was the one thing I was like, we need to partner up with Barbicide. If we're going to do anything in the community and in our industry, Barbicide is where we need to do it, because you guys are the leaders in sanitation and keeping things right in the barbershop in our industry. So again, I thank you, and just looking forward to working with you and making everything great.
Yeah, and thank you for saying that. And one of the programs Charlotte and I were talking about launching this year was a program about putting collateral, we were going to try to get some, famous men, so to speak, men that other men would listen to make, posters and things like that about men's health, things they should be getting checked, what's a normal blood pressure, those kinds of things. And partnering with a group like you to do that would certainly make it more credible. I'm a nurse, so I know those numbers, but I very rarely go into a barbershop and start talking to men. So that's not something I do. So maybe that's something down the road. And before we get to Perry, I'm just going to say to Perry, Barbicide's located in Milwaukee, but I live in Kansas City. So we can do walks in both places. If you come to Kansas City, you get 2 states for the price of 1, Kansas and Missouri. And would love to work with you guys on that. So Perry, you get to close us out here. Tell us your last closing thoughts, and also how somebody can reach you. We will send that in an email, but if somebody wants to just hear it, let them know what that is.
That's hilarious you just said that, because the first thing I was going to say was we are very active on Facebook and Instagram. So our Facebook is the National African American Male Wellness Agency. Our Instagram is AAWellness Agency. Please correct me if I said that wrong, guys, because I'm not heavy on social media myself. But what I wanted to add, and I think I mentioned this earlier, but I really wanted to reiterate this, is that our main goal is to get people to realize that through prevention and early detection, you can live longer. A lot of times people are scared to go to the doctor because they don't want to find out what the answer may be, or they may be feeling sick or not well, and they don't want to know, they don't want to hear something really bad, and our thing is, just go get the answer, see what's going on, so that way you can have a better chance at living a longer, healthier life. So please go to the doctor. Our mantra is for men to know their numbers. So know your numbers, get moving, which means to exercise, and go to the doctor annually. So I'll leave it at that.
Quit smoking.
Exactly, that too.
Quit smoking banner.
That as well.
Yeah.
So yes.
So thank you guys very, very much. This has really been interesting. I really love what you're doing. I think you can tell, I've said it a million times, I really love what you're doing. I'm eager to see what the response from our audience is to this interview, to working with your program. But I think we'll be seeing a lot more of each other. And hopefully we're doing an on-site interview at a walk somewhere, whether it's in Kansas City or whether it's in Wisconsin. But I look forward to working with you guys further.
Milwaukee and Kansas City, we'll see you soon.
Thank you so much.
Thank you so much.
Thank you.